Let me start with a true story. A few weeks ago, a woman named Linda came into my clinic. She is 72 years old, bright, kind, and very aware of her health. But that day, she did not feel like herself. She was tired all the time. She had trouble walking without feeling lightheaded. Her legs hurt. Her thinking felt cloudy. She told me, "It feels like I am falling apart." Naturally, she thought something serious was happening. She was afraid it might be something like a stroke or a brain problem. But after listening to her story and looking at her chart, something else stood out to me. Linda was taking 12 different medications every day, and not just for a few months. Some had been added years ago and never reviewed again. So I asked her, "Do you know what each of these medications is for?" She paused, then said something that really stuck with me. "Honestly, I do not. The doctors just kept adding more over the years. I never thought to ask." Linda is not alone. What happened to her is happening to millions of older adults. And yet, very few people are talking about it. I want you to stay with me because today, we are going to talk about something that could change your life or the life of someone you love. We are going to talk about why so many seniors are taking too many medications, why this happens, and how you can take back control. So let's get started. It usually starts with one pill. Maybe your doctor prescribes something for high blood pressure. Then a few months later, you get another pill to help lower your cholesterol. You might start feeling some pain in your knees or back, so they add a medicine for that too. At night, you are not sleeping well, so a sleeping pill gets added. After that, something for your stomach. Maybe a vitamin here and there. Then a pill to deal with the side effects from the first few pills. Years go by. You visit a heart doctor, a kidney specialist, maybe a bone doctor or a nerve doctor. Each one focuses on their own part of your health. They each prescribe their own set of pills. Before long, you are on 10 or more medications. No one stops to ask, is all of this still needed? Here is what often gets missed. When each doctor focuses on one area of your health, no one always looks at the whole picture. Your heart doctor is focused on your blood pressure and your heart rhythm. Your stomach doctor looks at your digestion and bowel health. Your brain doctor checks your memory or mood. But what about the way all these pills interact with each other? What about how they make you feel overall? The truth is, many doctors do not have time to go through every single pill. Visits are short. Everyone is in a rush. And unless someone speaks up, the list just keeps growing. That is how overmedication starts. It is not done on purpose. No one is trying to harm you, but it builds slowly over time until it becomes a hidden problem. Now let's talk about what all of this really means for your health. When your body gets older, it does not process medicine the same way it used to. Your liver and kidneys slow down. This means medications can stay in your body longer. They can build up. Their effects become stronger. And their side effects hit harder. Let's say you take a pill to help you sleep. It might also make you feel groggy in the morning. You may wake up dizzy or unsteady on your feet. That raises your risk of falling. You might think it is just a normal part of getting older, but it could be from that one pill. Another example is medication for pain. Some of these drugs affect your memory and reaction time. They can make you feel confused or forgetful. Again, people often assume this is just part of aging. But it may not be. It could be from taking too many pills or from the way those pills mix together. And here is the worst part. When these side effects show up, they are often treated like a new medical problem. If you feel weak, your doctor might check for anemia. If you feel confused, someone might think it is early dementia. Then another medication gets added to fix the new problem. And the cycle continues. This is one of the main reasons older adults end up in the emergency room. Not because of a new disease, but because of complications from the medications they are already taking. So while medications can help save lives, too many of them at once can lead to very real harm. If this is such a serious problem, you might wonder why it is not talked about more often. There are a few reasons. The first is trust. Most people trust their doctor. And in many cases, that trust is earned. Doctors are trained to help, to listen, and to treat illness. But in today's world, many doctors are overwhelmed. They have more patients than ever. They are expected to follow long lists of guidelines and checkboxes. Each visit is often limited to 10 or 15 minutes. It becomes very hard to review everything in depth. Because of that, the easiest and fastest thing to do is to write a prescription. It is quicker to treat a symptom with a pill than to search for the deeper cause. And it becomes a habit. One pill after another, visit after visit. Second, the healthcare system is not built to encourage deep medication reviews. Doctors often work in their own specialties and may not always share full information with each other. So the person caught in the middle is the patient, who may not even realize they are taking too many things. Third, many older adults feel uncomfortable asking questions. They do not want to seem like they are doubting their doctor. Some feel guilty for speaking up. Others feel too confused by all the medical language and do not know what to ask. And finally, overmedication has become so common that it starts to feel normal. If everyone around you is taking 10 pills a day, you might think that is just how it has to be. But it does not have to be that way. The good news is that there is something you can do. And it starts with asking the right questions. If you or someone you love is taking 5 or more medications, it may be time for a full medication review. This means sitting down with your doctor or pharmacist and going through every pill, one by one. Ask what each medication is for. Ask if it is still needed. Ask if the dose is correct. Ask if any of the medications are overlapping or causing side effects. You have every right to know. Some pills are only meant to be taken for a short time. Others can be lowered or stopped after a while. But if no one checks, they just stay on the list forever. You can also ask your local pharmacist for help. Pharmacists are trained to look for drug interactions, duplicate medications, and signs that a person may be taking too much. Many pharmacies offer full medication reviews, especially for older adults. It also helps to keep a written list of all your medications. Include the name of the drug, the dose, how often you take it, why it was prescribed, and which doctor gave it to you. Keep this list up to date and bring it to every appointment. Most important of all, pay attention to how you feel. If you notice changes after starting a new medication, speak up. Do not assume it is just age. Your body is giving you a signal. Listen to it. Reducing the number of medications you take does not mean you are giving up. It means you are making smarter choices. It means you are focusing on quality, not just quantity. Let's go back to Linda. After we reviewed her medications, she stopped 5 of them. One was causing dizziness. Another was making her feel groggy. 2 others were no longer needed because her health had improved. Within a few weeks, she felt more alert, had more energy, and said, "I feel like myself again." That is the kind of result I want for everyone. Overmedication is a silent issue. It sneaks up over time. But once you know it is there, you can do something about it. So if you are taking care of yourself or helping someone you love, take a few minutes to look at the full list of medications. Ask questions. Speak up. And remember, you deserve to feel better, not just to manage symptoms. If this video has helped you, please hit that like button and share it with someone who could use it too. And of course, subscribe to stay updated with our latest content. Thank you for watching and see you in the next video.